For Wall Street Media, this is Nikki. I'm here with Doug, and we'll help you make money in the stock market with information you can't find anywhere else.
Well, hello there, kiddo.
Well, hello.
We don't really match today.
Oh my God, we totally do. Blue is blue. Blue is blue.
I love this conference, guys. JMP Securities Healthcare Focus Conference. This is going to be different and better than a lot of the ones that you've ever heard before. I know these things. You have analysts that ask great questions here and then follow up with a better question about, yeah, but when is this going to happen, or don't these competitors have this? This is really great stuff.
Great stuff. You can watch it yourself at wsw.com/webcast/JMP7. But first, we have a video. Jason Sagarian, Director of Media Relations for Eclipsys Corporation, ECLP, discusses growth in hospitals and focuses on their existing client base.
So this is just a brief overview of all of our solutions. We have portals at the front end which give, for instance, a patient portal that gives the patient access to their health record. We have analytics or reporting solutions that help drive clinical, operational, and financial improvements through a series of reporting packages. We also have our workflow solutions. So at the front end of the process, the access, which is enterprise scheduling and registration. And then within the clinical, we have acute, ambulatory, high acuity, and departmental. And then in the financial area, sort of the revenue cycle component is the patient accounting, so generating the actual patient bill and what it takes to get the bill out, help hospitals process cleaner claims. And then finally, performance or decision support. This is, we acquired a company, Sunrise EPSI, in February of 2008, and that's given us a modern, scalable solution to help hospitals address their performance improvement goals. So the Eclipsys market opportunity. So at the front end here, you see the U.S. enterprise clinical market, and we estimate that to be around $4 to $5 billion over the next 4 years. And that's the largest segment of growth there for us, as I said earlier, is the community hospitals, the 200 to 500 bed hospital. So those are not largely unpenetrated. We expect around 300 buying decisions in that segment over the next 4 years. The revenue cycle, this is for us, for Eclipsys, is a replacement market. So companies have antiquated solutions, 15 to 25 years old, and industry studies estimate that around 25% of hospitals over 200 beds will replace their financial system in the next 2 to 3 years. White space, and so this is selling into our existing client base. So Eclipsys markets and sells around 30 to 32 solutions. Our current client penetration is around 20% of our solutions, so that gives us a lot of market and room to sell into our existing client base. And then finally, international, which for Eclipsys, the addressable portion of the international market, we anticipate is around $1 billion over the next 4 years. We've signed our first client there, Sing Health, as I said earlier, and then Sing Health should be going live this quarter, and that will hopefully be a catalyst to help us drive more business in the area.
Yeah, I like this guy. You know, a lot of technology is coming into medicine, and medicine's relying more and more on that. And I see today they just set up like their own social media network, right? Social media network.
He's speaking my language.
Yeah, that's right.
Anything social.
I don't think it was Facebook though that they were setting up, right? I don't think anyone said like, oh, like walks on the beach. I think this was more like business related, and I thought that was pretty good stuff. I really like this JMP conference. I really like the structure of it, how the analysts are asking such good questions. Really good stuff.
Right. Richard Pascoe, CEO of Somaxon Pharmaceuticals, SOMX, talked about establishing a U.S. commercial platform, new product launches, and the insomnia treatment Silanor, and strategies to introduce Silanor to the marketplace.
Man, I could use some of that. We got to start getting some free trials. I haven't slept for a week.
Sudhir Agrawal, PhD, CEO and CSO of Idera Pharmaceuticals, IDRA, talked about the importance of toll-like receptors, future goals, and clinical trials for new compounds. Michael Partridge, Senior Director of Vertex Pharmaceuticals, VRTX, spoke about their lead drug, Telepriver, the development of 2 new compounds, and their vision to eradicate the HCV virus in treatment-naive and treatment-failure patients with Telepriver. John Stonehouse, President and CEO of BioCryst Pharmaceuticals, BCRX, talked about Paramivir, an influenza neuroamidase inhibitor, which has over 1,000 patients tested already. By the end of next year, they will be in 3 different clinical trials with the drug, while their partnership with Shionogi in Japan is moving ahead with a planned Phase 3 outpatient study in 2009, which gives BioCryst milestone payments.
Yeah, that's beautiful stuff. These guys are up 8% today. The Dow's down a little bit, right, while they still try to dig out. The Fed really needs to just cut rates by 1 point. Australia must have the smartest people in the world, right? Because they cut rates by 1 point. Bam! Saved their economy, right? Save their economy, Jeremy. And that's what they need to do here is cut by a point and do it quickly. But BioCris doesn't need them to. They're up 8% today.
Not bad. Michael Collada, CFO and EVP of PharMerica, PMC, said that 19% of PMC's total drug spend will convert to generic in 2008 to 2010, while 9 of their top 50 drugs will convert to generic by 2010. He also talked about the company's strategic advantages, including the development of an e-prescribing platform. Schaefer Price, president and CEO of Pharmacet, VRUS, talked about the drugs Chlorodyne for the treatment of HBV R7128 for HCV, Rossur for HIV, and the development of commercialization of these drugs in the marketplace.
Now, what if he had a daughter and she met German Mike? Would they be Schaefer?
I don't know. Schaefer.
The world would end right on the spot. What's Human Genome say?
Tim Barabe, CFO and SVP of Human Genome Sciences, HGSI, talked about the growth of products in Phase 2 and Phase 3 trials, the commercialization of current Phase 3 products, and products launched in the next few years. Vincent Milano, President, CEO, and CFO of BioPharma, CPHM, talked about the benefits of acquiring Lev Pharmaceuticals, the clear medical need of Cinryze for hereditary angioedema, and their continued focus on CDI patient treatment. Mitchell Sayar, Chairman, President, and CEO of Immunogen, IMGN, talked about how trastuzumab DM1 works and the benefits of using it to treat tumors, as well as the anticipated milestones expected by 2009. Richard Brewer, CEO of Arca Biopharma, NUVO, spoke about the recent merger with Nuvelo and discussed beta blocker, Gencaro, and the pathways to market in 2010, and also the development of NU172, an anticoagulant, which Nuvelo has brought to the merger. Declan Daly, President and CEO of Isologen, ILE, talked about the company's pipeline using their Isologen therapy for wrinkles, for which they have a pre-BLA meeting scheduled for November, acne scars, full face, periodontal, and restrictive burn scars, all of which are in different phases or trials. Brian K. Ferroli, CFO of the Shaw Group, SGR, discusses the U.S. electricity consumption. He also discusses the business strategy with the technology to differentiate them from competitors. Jean-Pierre Somadosi, PhD, President and CEO of Idenix Pharmaceuticals, IDIX, talked about the development of new inhibitors and late-stage trials of currently focused inhibitors, initiatives for company growth, and discussions for new partnerships.
Hey guys, that's a fabulous conference.
Lots of stuff.
There's an awful lot of good things there, and I'm telling you, the analysts asking the questions and then follow-up questions and more questions, they kind of flip things around where instead of having like the usual 20 minutes or 25-minute presentation and then one question where they say, hey, how'd you get to be so smart and handsome? They actually, and everybody kind of golf claps and they go out to lunch. They ask really good questions here. This is good stuff. You should listen to it.
Great stuff. We're here every day at Wall Street Media. You can find us directly at WSMCO.com. Thanks.